Hi, my name is Yeol Yang. I'm an assistant professor of orthopedic surgery at Jeonnam National University in South Korea. I'm honored to have the opportunity to discuss our JBJS article titled Preoperative Hindfoot Alignment and Outcomes After High Tibial Osteotomy for Varus Knee Osteoarthritis. The hip-to-calcaneus axis, known as the ground mechanical axis, is defined as the hip center to the ground reaction point at the lowest point of the calcaneus. It has attracted attention as an alternative to the hip-to-ankle axis. Despite its possible effect on clinical outcomes, HTO has generally been carried out without a careful evaluation of subtalar joint. We identified 128 patients who underwent HTO between 2018 and 2020. Patients were classified into two groups, a hindfoot vagus group and a hindfoot varus group. We compared the clinical and radiographic outcomes following HTO between the two groups and suggested a preventive strategy for possible excessive weight-bearing, line ratio differences between the mechanical axis and ground mechanical axis. Some interesting findings that we saw were that hindfoot alignment angle was improved in the hindfoot vagus group. In contrast, in the hindfoot varus group, the coronal alignment of the hindfoot showed no improvement, and the locations of the mechanical knee joint access point were different between the ground mechanical axis and conventional mechanical axis because of the decreased flexibility of the subtalar joint. Another interesting finding we saw was that the hindfoot varus group had worse clinical scores than the hindfoot vagus group. As far as its impact on practice, our findings indicated that the group with a preoperative fixed hindfoot varus deformity had a higher rate of undercorrection and worse clinical outcomes, especially pain following HTO. Therefore, modification of the procedure to shift the ground mechanical axis more laterally may be necessary for these patients. I think the findings from this study do suggest that thorough evaluation of the patient's ground mechanical axis and any fixed or flexible hindfoot alignment should be considered prior to HTO to provide crucial information regarding the expected outcomes. We walk on our heel, not our ankle. Thank you.